Hello, my name's Dr. Arthur Mark. I'm with Seaview Orthopaedics for 21 years. I specialize in adult reconstruction, or in layman's terms, total joint replacements and revisions. Today we're going to talk about osteoarthritis of the hip. So osteoarthritis is the general arthritis or the wear and tear of your joints. Typically it happens as you get a little older. There is a genetic predisposition. If there's people in your family that have arthritis, then you have a higher probability of getting arthritis. This differs from rheumatoid arthritis, which is actually an autoimmune disease. That means that your body is constantly attacking itself and causing inflammation around the hip and the knee joints. There's also another type of arthritis, which is post-traumatic arthritis. That is, if you had an injury where you damaged your hip or knee joint, then that could cause arthritis in the future. Classic symptoms of hip arthritis is typically stiffness. I tell my patients that you're going to have stiffness before you have pain. It's typically difficulty in ranging your hip. So you have trouble putting on your shoes and socks or doing toenails or getting up out of a chair. Typically, arthritic pain is worse when you first get up and then typically gets a little bit better once you get along. For example, if you get out of a chair, it'll hurt you in your groin area for a while, and as you walk for a minute or two, it tends to feel better. Classic hip pain is in the groin area and kind of radiates down the front of your thigh to the top of the knee. It can also be around your buttock area, and again, it's classified as stiffness, difficulty moving your hip joint. So typically, osteoarthritis of the hip is diagnosed. Number one, history is very important. So like I said, if you have difficulty putting on your shoes and socks, going up and down stairs, or stiffness and pain around your groin area, that's pretty classic for hip arthritis. In addition, when you come in, most of the times we will do a physical exam. I will actually check your range of motion of your hip, and if it's decreased, that's very classic for arthritis. And finally, most importantly, are plain x-rays. Regular x-rays give me a ton of information. Here's an example of hip arthritis. On the right-hand side is a relatively normal looking hip. You can see a nice round ball, and you see a space here, that's the cartilage. On the left-hand side here, or your right, there's significant arthritic changes. You can see that the ball's no longer round and you no longer see that space. That is what we call bone-on-bone arthritis. In addition, you can sometimes see bone spurs. So treatment options for osteoarthritis of the hip. There are many different types of treatment we can do that are non-surgical. The first things that help us the most are activity modification and stretching. So things that are important is to stay active, keep your joints limber, and stretch. We can do this formally with physical therapy, or you can do exercises on your own. The more exercise you do and the less weight that you put on your joints, the better they feel. Other things we can do for you are taking medications. There's basically two types of medications. There's pain medications such as Tylenol, which take away the pain, and then there's anti-inflammatories like Motrin, Advil, or Aleve. I feel that anti-inflammatories work really well for hip arthritis. The word itis in arthritis means there's inflammation. So as your cartilage degrades, it causes inflammation around your hip, and the anti-inflammatory medications really get rid of the inflammation and make your hip feel better. If that doesn't work, the next step would be to try injections. Typically, we do cortisone shots into the hip. And all a cortisone shot is putting an anti-inflammatory medication directly into the hip joint. This provides very strong anti-inflammatory effects and can really relieve a lot of the pain for a number of months. So when you have failed to conserve treatments such as pain medications and activity modification and even injections, and the pain is getting to the point that you can't do the things you like to do, whether it's playing golf, playing tennis, or just walking around the block without pain, then it's time to consider hip replacement. Hip replacement has come a long way. It's a great procedure. It has the highest patient satisfaction of any orthopedic procedure we do today. If you get diagnosed with hip arthritis, everybody's a little bit different. If you can tolerate the pain and still do your activities that you like to do, then you can hold off as long as you want. Just because you get diagnosed with arthritis doesn't mean that you will eventually need a hip replacement. There are people that progress very slowly and then people that progress very quickly. But if your hip pain is getting to the point where you're not doing the things you like to do or prevents you from going out and doing simple things as grocery shopping or getting in your car or walking around the block, then it's time to talk to your physician about treatment options. So risk factors for people getting hip arthritis are people that have an inflammatory or rheumatological disease, things like psoriatic arthritis, rheumatoid arthritis, ankylosing spondylitis. They can cause your hip joints to deteriorate more quickly. There is also tends to be a family history with people with osteoarthritis. There is a pattern of arthritis that happens in people that present in their 50s. And then there are people that have congenital abnormalities that were born with abnormal hips that can sometimes need hip replacements at very young ages. And then there's always diseases that can cause damage to the hips. Things like sickle cell disease can damage your hips. If you get cancer and you get chemotherapy, the chemotherapy can also destroy the blood supply to your hip. These are other reasons why you might need a hip replacement. Prevention for osteoarthritis, unfortunately, some people are dealt a bad deck of cards and they are predisposed to the arthritis. But the things that you can do to prevent your arthritis from getting worse is to take the pressure off the hip. So if you're overweight, then you can lose some weight. Smoking is very bad for the hip joint itself. Exercise helps the hip tremendously. So staying active and keeping your weight down is probably the only things that you can do to prevent your arthritis from progressing quickly. If you feel that you're having this pain in your groin area and difficulty doing the things you like to do, or you're concerned that your hip may be arthritic, it's a good time to talk to your primary care or come into Seaview Orthopaedics and talk to one of our orthopedic specialists. We specialize in taking care of hip arthritis, and just because we're surgeons doesn't mean that we're going to jump to surgery right away. There are many other treatment options that do not involve surgery that can give you significant relief without having to go to surgery.